Welcome into HealthWise, the TV show. I'm your host, Ralph Hipp, and delighted I've hosted 50 episodes of HealthWise since it came back on the air, a kind of a milestone program today. My guest this Friday is Dr. David Wensel. He's back with us again today, the medical director at Midland Care. And Dr. Wensel returns to tell us more about the PACE program, PACE standing for Program for All-Inclusive Care for the Elderly. As for the past decade, the wonderful people at Midland Care have had the help in helping seniors stay in their own homes, continuing to get the health care that they need. And Dr. Wensel is a big part of helping make that happen.
Well, thank you so much for having me back.
All right, our pleasure to have you here. I gave a little description, David, but in a nutshell, what is the PACE program? How do you define it for our seniors watching at home?
Well, we really define it as a way of helping seniors remain independent and continue living in the community, which is always better for them rather than moving into facilities. So the program of all-inclusive care of the elderly's been around for a long time now, 10 years now in Topeka, and we've been serving frail elders to keep them living in the community that entire time.
And what are the parameters, Dr. Wensel, who is available to be in the PACE program? Do you set some boundaries on that?
Sure, yeah. Medicare and Medicaid both, the eligibility requirements are that you be 55 years of age or older. Yeah,
okay.
55 years or older. And the Jayhawk Area Agency on Aging screens the participants who might be interested in PACE to see if they're at nursing home level of function or higher in terms of their functional requirements. So that screening gets done, and then if a person or family is interested, they can contact us, and that screening is free. And then we would look at them to see if they're eligible for PACE or not.
All right. Well, Midland Care provides PACE to our seniors in Topeka and Lawrence and Kansas City, right?
Yes, we just opened a new PACE center and clinic and adult day center in Kansas City, Kansas in November of last year.
So do you have a number? How many seniors are you serving currently
Right
in the
now,
PACE
about
program?
270.
Okay, 270. So talk about at the Kansas Park at 6th and McVicker.
Yes.
We just had a groundbreaking for a day center for the adults. And tell me more about how big a step this is in the advancement of the PACE program.
Well, this is a huge step, and that's going to be our Compass Center, or the Center for Senior Independence. That is going to be a resource center for all seniors in sort of north central Kansas. So it will provide the Meals on Wheels program a home.
Right, it will be
also,
home for them.
And it'll also be a place where we'll have an adult day center. Our PACE center will be there. We'll have a medical clinic there and a resource center for seniors in north central Kansas.
How is the planning of this? I said, well, when we break ground and we open this new Compass Center, when you're describing the things you just told us about, the planning of that, how long has it been in the works, and very specific things that you had set out to accomplish when this all began? Yeah,
so the planning for this has been going on for a long time, for many years now. And originally when I came to our PACE program 8 years ago, the state had our PACE program capped at 50 patients. Once that cap was lifted and we were able to enroll more patients, we quickly began to outgrow the building we had. And so the planning began probably 2 to 3 years ago about what building would work best, or where could we go. And this partnership that we have with the 501 school district is perfect in terms of being on their campus, opening up a building, being a resource center, and even providing education to the local students, because we are an educational resource center for Washburn University, for the school district, and so we'll be providing a lot of education out of that center as well. So I think it's a great sort of partnership or collaboration with the school district, with Meals on Wheels, and with Midland to provide community services in this community and really all the communities we serve.
And the central location is key.
It's perfect in terms of where it's at, the building's located, and in terms of providing the services that are needed in this community.
Dr. David Wensel, other than, let's say, they were not 55 years of age just yet, what are the things that they would not qualify at this point for the PACE program, maybe in the future?
If they were older than 55 but were not at nursing home level of function. So that key distinction is that we are looking at frail elders who would otherwise, their only choice would be to go into a nursing facility. So we wrap services around them with our PACE program to keep them living in the community.
When they are in the PACE program, is there just a certain amount of time that they are eligible to be in PACE?
No, PACE can care for them from the time they're enrolled until their death. We provide all the services to them, and it is all inclusive. So it includes all disciplines. That's one of the unique things about PACE is it's not only medical services, It's pharmacy services, it's therapy services, we have dietitians, physical therapists, occupational therapists, social workers. We have home health aides. We have a transportation department. So to be a PACE center, you also have to have transportation to get patients or family members back and forth to the clinic appointments and medical appointments.
Right. Tell me about the costs involved. Is it all Medicare covered, or how do they pay for that?
It's not. I mean, some of it is out of pocket, and Medicare covers some of it, but it is it's much. I would say it's much cheaper than paying room and board at a nursing facility.
Sure.
In terms of all the care that's provided. So that is one of the questions that comes up a lot from seniors in terms of, if I have financial resources, how would I be able to afford it? And the question I always ask is, well, if you're paying room and board at a nursing facility, this is a better way to have care provided to you in a more all-inclusive way and keep you living in the community.
Sort of a bridge, David, between home care and nursing home care?
Actually, it's not a bridge. It's actually
you wouldn't describe it as a bridge?
No, I wouldn't. It is a program instead of a nursing home care.
Instead of, okay. So if this sounds like something that you're interested in, let's say for your mom or for your dad, Midland Care, Dr. David Wensel, the medical director of Midland Care. You are at midlandcare.org and /PACE. They can find out more about it. They can also call this number.
Yes, and that, as you see on the screen there, that's great. And as you talked about, we did have our groundbreaking service last Friday for the new building, and we kicked off our capital campaign for that building. Okay,
726-7450. That's a toll-free number anywhere, anyone that's watching our program right now. No charge for that call. And do check out the costs involved in that, and if PACE, the services of PACE through Midland Care, might be just right for you. Dr. David Wensel, and we love having you come over,
always.
and we'll see you again next time for what you'd like to talk about, charting the progress of the Compass Center.
Yes.
That'd be so great. Well, as we get ready for exercise, we want to feed you some dinner, as HealthWise is hosting those monthly senior suppers at Stormont Vail, the second Monday of the month, now through November, so those 3 more to go. You're invited. Your $5 dinner is served at 5:15 that second Monday. Then you'll hear a great speaker talk about an interesting health and wellness topic. Call 354-5225 to make your reservation. Up next for you, get ready and warmed up. We hope you are right there where you are. We have our HealthWise TV exercise segment, some fun, invigorating, low-impact exercises, and check with your doctor before you start this or any program.